Welcome back to Valley Life. I'm Alicia Safias, and today we are getting a 101 on the newest and latest dental implants from Dr. Scott Jett. Thank you so much for being with us.
Thanks for coming today.
All right, we talked a little bit last time about lasers and how far things have come in that aspect. Now we're talking about dental implants, and I am shocked that this is something that can be same day and we can actually go back to work. So you need to catch us up on where we have all been. First, let's start with kind of a demonstration about this. If we can see this, tell us a little bit about this.
So your typical patient will either have a missing tooth or have a bad tooth. If they've got a bad tooth in place, we can extract that gently and have them come back a few days later or a few months later to actually place the implant. The nice thing about dental implants now is that it's an outpatient procedure. We do it under local anesthetic, and the implant itself is nothing more than a titanium rod, maybe the size of a matchstick.
And that's really come a long way because it will never decay. I mean, we don't have to worry about it. You were saying kind of like a bionic tooth, and it really is.
It is. It is. They can't get decay. They can't succumb to gum disease if they're well taken care of. And the beauty about them is if they're placed, and they're placed under good conditions by a well-trained surgeon, they should last a lifetime.
That's amazing. And, you know, a lot of people think, okay, if I have a missing tooth or I need a dental implant, I'm going to get a bridge. It's going to affect a lot of teeth in my mouth. That's not true anymore. You actually do one tooth.
Yeah, there are patients who need multiple implants, 4, 6, 8 implants to restore an entire mouth. But our typical patient needs between 1 and 2 teeth. They've got an old molar or a cracked tooth, or they've had some trauma. We've seen athletes where they come in the same day with a missing tooth. And now we can actually place an implant under the local anesthetic, have them plan for Motrin or Tylenol and not much missing any work or school or their athletics. They can even have a tooth placed on the implant the same day sometimes.
Unreal. And that is the case with getting right back into her life. We have a patient here, Joanne. Thank you for being with us and being our guinea pig today.
You're welcome.
You had a great experience with Dr. Jett. You actually went on a vacation right afterwards. Tell us about the process you went through.
Well, we started, and I came in and took the impressions and everything that needed to be done before the procedure. And I was immediately put right at ease. And the office is charming and very warm and very friendly. But we had a trip to Europe planned, and I said, we can do this, but I have X amount of weeks that I won't be available. What can we do? And doctor worked right around my schedule. It was wonderful. And came back, didn't miss a beat, and we just proceeded from there.
I imagine this is something you may put off like a lot of people out there. You probably knew you needed something a long time ago, but it's kind of intimidating. And again, with the time factor and everything, were you surprised at once you got it done, it was not as bad as you thought?
It was not as bad as I thought. You're correct. And I was very surprised with it. But I had started another dental procedure, and so this was in the timeline and needed to be done at this time. But everybody was able to work together and with my own dentist and here, and both offices coordinated it, and they were wonderful here. Yeah.
Well, your smile is beautiful. Smile for us. I love that, and I imagine that you love that too when your patients come back to you and are smiling all the time and report back to you. What would you say to people out there who are maybe like Joanna, you're kind of a little intimidated at first, and then
I want them to know it's a dental procedure. They do typically see a specialist. I'm a periodontist, and it's one of our specialties. But as a whole, it's a 45-minute visit for a single tooth implant, up to an hour or two if you have multiple implants for dentures or for large amounts of missing teeth. But for most people, it's easier than a lot of the dental procedures they already have done. We go out of our way to make it a good experience, and they're some of our happiest patients.
And this isn't something that we associate with older patients or anything. Actually, the average age is a lot younger than we may think.
Yes, I have patients patients who are missing teeth just born that way. From orthodontics, I work with orthodontists in the area. We have a lot of patients in their 20s, 30s, 40s, 50s. It's just become probably the most common way to replace a missing tooth these days.
Okay, and I know a lot of people out there want to get a hold of you. Are you accepting new patients right now?
Yes, we typically are. We always are, but we're typically referred from your general dentist. So if you have a good general dentist that you trust, you can always contact us directly, or you can ask your general dentist.
All right, and you would say that it's not as bad as people think?
Absolutely not, and the proof is here.
And just for a lot of people that don't know, you are local here. You've been in the community for a long time, and so you deal with a lot of people coming back to you.
Yeah, I was born and raised in the area, grew up out on the river bottom out in Sanger, and so this is my home.
Yeah.
This is my community, and I'm just honored and humbled to get to treat my patients and my family and my friends this way with such a great technology.
Well, We really appreciate Dr. Jett making all of us smile a little more. Thank you for being with us. And Valley Life will be right back.